Look, the decision then to stop this funding has far-reaching consequences. In fact, many organizations that are reliant then on what is known as the US's Agency for International Development, or USAID funding, have been forced to kind of close, actually, sparking fears of what could be a substantial surge in AIDS-related deaths, as well as job losses. In fact, doctors and program managers say that essential services for people living with the disease have actually been severely impacted. Let's cross to Lumka Bekindawo, who's speaking to one such doctor and joins us live now. Lumka, let's just get a sense from this doctor, if you will, just with regards to what does this do for future, and where can the money perhaps come from, if he knows a way at all, and what happens to the patients now?
Arabile, as we know that according to statistics, South Africa has about 8 million people who are living with HIV, and this is the highest number globally, and health experts say that the USAID funding cut would lead to more than 500,000 extra HIV deaths over a decade. So now this has had a negative impact to the organization and the projects that had to close after the US has decided to cut the funding. But now I am with Dr. Kate, who is a specialist who's going to speak to us now. Doc, thank you so much for speaking to us. I want you to speak to us and the impact that has the impact of this USAID funding cut.
Thank you so much. So the impacts of these funding cuts have been quite enormous in South Africa, but also in other countries around Africa. In South Africa, they've had a huge impact on our HIV program. As you said, we have such an enormous number of people living with HIV. We also have at least 1 million, a little bit more than 1 million people who are not on treatment. And that is a major problem for them because it leads to ill health and they can even end up dying. We are very lucky in that our government pays for our HIV treatment. However, it takes a lot to get that treatment to the people where they need it in a way that is accessible and in a way that they can take it their whole life long, be coming to the clinic or to their point where they pick up their medication without interrupting their lives, their jobs, their livelihoods. And so that's where these other organizations have come in, and we've been doing a lot of amazing work around innovative ways to help people take their medication. Those programs are now in danger. The other thing that is really, really worrying is the testing and prevention programs. Now we know HIV testing needs to happen continuously. There's not come to a point where we can stop testing people. However, the HIV testing is going to dip sharply now. We've had community organizations in the community finding people, asking them if they'd like to test, helping them to test quickly, helping to distribute self-tests, which also empower people to test themselves. The other people that really are going to struggle are people like young adolescents, young girls, young women, who are now the specific programs that have targeted their needs. You know, they're in school during the day, perhaps trying to work. They've got very specific needs compared to adults, and the programs that address their needs, a lot of them have been ended. And so it's really concerning for those people.
All right, Doc, what can be done, maybe trying to help those that are only depending on this fund?
So there's a couple of things, and the one thing is that we really need to think about emergency funding. I know there is a possibility of emergency funding that is being explored. This is really critical because in a month or two, the organizations that were there that have been set up over 20 years are not going to exist anymore. You know, how long can you go without any funding? And so all of these systems are going to be dismantled. We need this emergency funding as soon as possible. And that could come from Treasury, it could come from private sector. We also need to be fighting these decisions in the US. And I know that there are a lot of ongoing court cases, and we should be supporting those because besides South Africa, a lot of the countries in Africa also, you know, are really dependent on this money, and they are our neighbors. So we all need to stand together and see what we can do about accessing funding.
All right. Lastly, you said that it's not easy for you to reach out to the people that are living with HIV. You are trying to reach out through their counselors. Can you talk to us about that?
Right. So we have, as partners, we've always had a lot of systems for how we communicate with our clients, including people called counselors who literally know that patients have got their WhatsApp numbers. They'll WhatsApp them any time of day or night. They've got a question. They're not sure what to do. They can't come to their clinic appointment. You know, they need that link that they're able to interact with, and that is now gone. So that is very difficult. So we're hoping to be able to speak more to the people on the ground.
Thank you so much for speaking to us.
Thank you.
Arabile, that's Dr. Kate, who is a health specialist here in Gauteng. And also, one of the things that we have noticed is that people who are living with HIV have started to panic after they have heard about the USAID funding cut. And now the doctors are trying by all means to reach out to those people and trying to help them. But for now, back to you in studio, Arabile.
Thank you so much for that one. I think, Lumka, one thing I'm just thinking about myself here is really just around, has this budget considered this? Has this next budget, as we go to it now, actually considered something like this? And whether the funding that is ultimately necessary here, that needs to be replaced when it comes to things like PEPFAR, when it comes to future funding, how much of that then perhaps needs to be put forward? So, Lumka, please, won't you just ask the doctor as well a little bit later on as well, just with regards to that, whether, you know, she would like to see a little bit more from that kind of funding. And we'll hopefully cross to you a little bit later on and have that discussion. Lumka, appreciate the time. Thank you so much.